Hello, I'm Jemie, CEO and founder of Psychable. With over 1.5 million visitors to date, Psychable.com is the leading online community committed to empowering individuals interested in legally exploring the healing potential of psychedelic assisted therapy. Today, I have the pleasure of speaking to Dr. Rafael Cruz of Kentuckiana Ketamine Institute. In his private practice based in Louisville, Kentucky, he provides a spectrum of advanced health solutions with an integrative, holistic focus. He is a board certified by the American Board of Emergency Medicine. He is also the founding member of American Academy of Ozone Therapists. Welcome, Dr. Cruz.
Thank you for having me. Good to be here.
Dr. Cruz, I was wondering if you can share a little about your background, your upbringing, and the path that led you to working with psychedelics, specifically ketamine.
Sure. So, as you mentioned, my original career was emergency medicine. I practiced for about 10 years. And in emergency medicine, if you have a child that can't sit still and they have a little cut that needs to be repaired, we often use ketamine to sedate those children so we can get a good repair and a good cosmetic result. So that was one of the first introductions I had to ketamine. We also occasionally used ketamine to intubate a patient who was in respiratory distress. And I then got more exposure to ketamine when I did a second residency in anesthesia. And we used ketamine when a lady's epidural failed and they needed an emergency C-section. Ketamine was the most reliable anesthetic because it was very easy to use quickly and it would support the patient's respiratory ability to breathe and support their vital signs. And so you didn't always have to intubate the patient, which was an advantage. And after all those experiences, I shifted into integrative medicine and regenerative medicine and functional medicine. And while in that space, my father, who's a urologist, said, "Hey, I've recently been reading about ketamine for mental health issues. Do you know anything about that?" And I said, "I've used ketamine a lot, but not for mental health issues." So I started reading, and there's a lot of information on PubMed. And so I basically got the most up-to-date research and created a protocol from all that. And I have a history in my past of pronounced anxiety and depression, even though I did emergency medicine. And people tend to think, oh, if you're an emergency physician, you don't struggle with anxiety and depression. Well, many of us do. But in my background, my mother had a lot of issues with depression, anxiety, addiction, and she killed herself when I was 18. And so, having that as a background and my own personal struggles with depression, I was very interested in a novel approach that was very quick and effective. And at the time, I wasn't struggling so much with depression, but I still had a fair amount of anxiety because, different things. And so I put the protocol together, and I had a colleague of mine prescribe ketamine to me, so I would experience everything that I was going to be asking patients to go through. And it was very, very helpful. My anxiety lifted in one session.
Wow.
And I was, very pleased with the experience. So then, 8 years ago or more, we launched, and I'm not exaggerating when I say in 8 years we've only had 5 patients who did not respond to ketamine.
Wow.
All of the rest improved dramatically, and the 5 that didn't respond were brought to our clinic almost by force. It was a younger person whose parents said, "You're coming, you have to do this." And these patients said, ketamine isn't going to work. And they proved that it didn't work. So the importance of that is that, we truly speak, pray, meditate, and think our world into existence. And if you, insist that you can, you probably will do whatever you want to do. And if you insist that you can't, you're probably going to manifest that outcome. And I stress to my patients that, the game of life is you play it every day, and you have to work on your skills and your self-talk to keep yourself, content and happy and moving in a positive direction. um, Overcoming depression is not like, getting a diploma, college diploma, you put it on the wall and it's always yours. It's an ongoing project that you're always fine tuning. And the best of us, no matter how happy we are, usually have some slumps, and we have to work our way out of those. And the key is having the skills to do it, and ketamine is a part of that. But you want to have other skills that you can use when, ketamine isn't immediately available to you. And as good as ketamine is, every good thing, if we overuse it, can become bad. And so that's, you have to be judicious in your use of ketamine, and not overdo it, and learn how to use other skills to keep yourself on your goals, and to keep yourself in a good positive mood.
Mhm. I was curious, what is ketamine and how would you describe the experience of ketamine?
So ketamine is an anesthetic that is used to put patients to sleep at a higher dose. And the beauty of ketamine, as I said, it supports vital signs. All of the other anesthetics that we use can take away your drive to breathe, can slow down your heart rate. And ketamine is the opposite in that, unless you give a very high dose, then you'll take away the person's drive to breathe. So it's great at controlling pain. It's great at helping you not remember the trauma that you're experiencing through surgery. It's been used in Vietnam and other military conflicts to help soldiers, because before we used a lot of morphine, but morphine depresses your breathing and your heart rate, whereas ketamine is going to support it. And it's safe enough to use in a battlefield. So it's traditionally thought of as an anesthetic, but roughly 10 years ago, some researchers at NIH used it in a depression situation. And in fact, there's a gentleman, Dr. Lilly, who used it for his migraines. He was a quote unquote psychonaut. And they discovered that even one treatment with ketamine was helping people who were acutely suicidal or depressed. And one treatment didn't hold patients very long, say a week to a couple of weeks. But when they did a series of 6 treatments, they were finding that patients went into remission for months, sometimes a short time, but the majority were in remission for many months, and some even years. And reading all this, was extremely exciting to me, because I suffered through a lot of misery with my depression and anxiety. And I was one of those, non-responders. Antidepressants didn't work for me. And so when I started reading that there was so much progress with this, I thought, I have the background, both personally and professionally, to bring this forward. And in my area, nobody was offering ketamine for mental health in my part of the country. So we just went ahead and started offering it, and it's gradually grown. And it's one of the most rewarding parts of my professional life, because it consistently helps people. And once the veil of depression is lifted, they can then start, learning the skills that are going to keep that depression at bay, or that anxiety at bay. And it's just been really, really fun and exciting to see. I mean, you get patients who are severely depressed and dysfunctional. One young lady in particular, she was the daughter of a psychiatrist, and she was bullied in school. She was homeschooled because, she couldn't handle going to school. And she was um, very much homebound. She had severe social anxiety, and the parents, the mother was a social worker, the father was a psychiatrist, and they were very worried that she would never emancipate. Well, she does 6 ketamine sessions and she feels great. She was able to go from the confines of her home to getting a part-time job as a hostess and going to college part-time. And um, she kept getting stronger and stronger, and she finally got her dream opportunity, which was an internship at Disney. And I was reluctant for her to go because, she was only, I think, 20, and I felt like she needed her parents' support, but I didn't also want to, get in the way of her dream. So she went and did very well for, say, 3 months, but then she fell in love with some guy, and um, they broke up, and she got her heart broken and she cut herself. And I don't know if I said earlier, but she was a cutter. She cut herself a lot since age 12. But she did this on Disney property, and naturally they asked her to leave. So she came home, and we were all devastated because here was somebody who we were all scared would never emancipate, and she was doing phenomenally well. And this was a huge setback, and it was, very upsetting for all of us, primarily her and her parents. Well, I'm thinking, this is, she's going to go back and be isolated and depressed for a year, and who knows if we'll ever get her back. Well, she came back and did 1 or 2 sessions with us, got her old job back, went to college, and today she lived with her parents for like 6 to 12 months, and then she ends up finishing college in Indianapolis, and now she's a drug and alcohol counselor. She has a boyfriend, and she lives independently.
Wow.
And so, that is a testament to the power of ketamine, and that once the person feels better and their brain is healing through the ketamine, which, as most of you know, creates millions of new synaptic connections between the brain cells or neurons, your brain starts to function better, and then you can think better, and you're much more effective at your self-healing skills and your life skills, whether it's work or home or school. And she is a wonderful testament to that. And we've had many people, not as severe as her necessarily, but she wasn't suicidal, she was just severely depressed. But we've had a lot of very suicidal patients, and a lot of patients who were so depressed that they couldn't maintain employment. But once the veil of depression is lifted, they get their brain back, so to speak. And one guy was a IT security guy, and he was unemployed for, I think, 2 or 3 years. He got ketamine, and then he got a job at the IT department of a neighboring hospital. And there's many, many, anecdotal stories like that of people getting their life back. One gentleman who was an engineer had been completely homebound, couldn't work, hadn't seen family for like 5 years, and he tried other psychedelics. He went to Jamaica to do mushrooms, and that helped him a little bit, but not enough. So then he came to our clinic, he did ketamine, and he attended his first family Christmas party. And he came back to tell us about it, and he goes, what's one thing is being able to attend it and to handle the stressors of being around family, but the biggest part that's amazing to me is that I actually enjoyed myself. I didn't want the party to end. And that happened because, his brain was better through ketamine. And he also had the skills that we had taught him to not let himself be overcome by certain social anxiety situations.
Yeah.
But to me and to many of us in this space, ketamine is a tremendous breakthrough that's far, far faster acting than antidepressants, more effective than shock therapy, according to a lot of research, and way faster than TMS, which usually requires 30 sessions. and not often covered by insurance. So ketamine is much more accessible, more affordable in many cases, and it gets the patient to their goals much quicker in the great majority of cases. In medicine, we rarely have anything that's, you know, 80% successful. And nationally, most clinics are citing that they're successful 70, 75% of the time. So, you know, we really have a phenomenal golden opportunity to help patients. And there's more and more traction, there's more and more acceptance of ketamine. Having said that, there's also a large pocket of physicians, both psychiatrists and family doctors, who are against it because they've embraced the prejudice that it's a horse tranquilizer, or it's a party drug. You know, but I forgot which Greek philosopher, there's somebody famous that said, you know, everything is in the dose. And you know, the dose can be poison or it can be therapeutic. And the doses of ketamine that most clinics administer are very low, and they're given judiciously and in conjunction with the input from the patient. And that makes all the difference in the world.
Yeah, that's remarkable. And I hear you on it's this is a collaborative process. What makes a good candidate for ketamine? And the follow-up question to that is, you cited, patients coming to you with depression. How do you work with patients who are currently on antidepressants that are seeking ketamine treatments?
So if the patient is on antidepressants, they should stay on antidepressants. And we like, you know, some patients just want help to get through the acute depression, and they want to stay on antidepressants because they found them helpful. Other patients want to come off of their antidepressant, and we like their psychiatrists to help guide the weaning off, because depending on the antidepressant, it can be quite challenging. And as most folks know, it should be done very slowly, not abruptly or cold turkey. Um, at the beginning of my career with ketamine, I was very selective in the sense that I only treated severe patients who had failed at least, you know, 7 to 10 antidepressants. And gradually, though, I've become more flexible, and we've treated reactive depression to spousal death or the death of a child. We've treated somebody who was very depressed after a divorce. We've treated postpartum depression, and, you know, probably a handful of patients who said, you know, I'm not depressed, but I feel stuck. And I've heard ketamine can help me in terms of personal growth. And so I've even allowed some patients who wanted to try ketamine from that standpoint. But we've used it for severe anxiety, PTSD, OCD, and the list is growing. You know, migraines, fibromyalgia, chronic pain, CRPS. There's a lot of areas where it can be helpful, and um, you know, it's still a very underutilized therapy, growing and more acceptance, but um, we need more clinics offering it and a greater amount of acceptance, because for those who have experienced depression, you know, but it's extremely crippling. I mean, you're stuck in bed and you can barely get yourself out of bed to take a shower. And once that, you know, the shackles of depression are lifted, you can claim your life again and start, you know, experiencing some joy. But when you're in that dark hole, you know, those of us who've lived through it see no light. And ketamine is like turning on the lights and saying, there is hope, there is a way forward, and, you know, we're here to help you. And it's amazing with, you know, the ketamine combined with some simple and easy skills, the profound effects that has on patients who, you know, were really losing all hope. And so it, you know, 8 years later, it's still one of the most exciting and fun parts of my practice.
That's remarkable. I was curious, what do you recommend to people trying to decipher between the different psychedelics that are available and which ones should they try, whether it's mushrooms or ketamine? How would you best guide them around figuring out which medicines they should try?
I think, everything begins with educating yourself. And, your website has a ton of extremely useful information, and there's a lot of other sources of good information. Dr. Michael Pollan from Harvard has written extensively and has some great YouTube videos on psychedelics. And he wrote about it and eventually experienced mushrooms, but at first he was very skeptical because of all the prejudice that he had been exposed to. And then he saw how transformative, mushrooms had been. And I think they all have their place, ayahuasca and San Pedro, and they all have advantages and disadvantages. Mushrooms, San Pedro, and ayahuasca remain illegal in most of the country. And, they're a longer experience, 4 to 8 hours, whereas ketamine for a mental health challenge is usually a 2 hour experience. So it's not so intrusive, but they all have their place and they all can be very beneficial to, I would say, the majority of patients. Sometimes you'll hear about people having a quote unquote bad trip, even with ketamine. But the beauty is it's still enhanced your brain in a positive way. And, I've had colleagues and friends who like to do ayahuasca, and they'll, San Pedro is the male plant form and ayahuasca is a female plant. And sometimes they'll say, this time I did it and went into ceremony, but mother ayahuasca didn't have any quote unquote answers for me. And then other times they'll have a profound breakthrough and figure out what they want to do with their business or what they want to do with their personal life. So you have to be open that each of these modalities is generally helpful. You may not get exactly what you want out of doing one session, but if you persevere and you surround yourself with people who are knowledgeable and are supportive, you will almost always get better. Because I mean, we've seen just people who were horribly affected by their mental health challenge, and they eventually get to the other side. And I think, I would encourage everybody to support, I would encourage everyone to explore all of them, but, be mindful that you have to do these other forms, ayahuasca and San Pedro, in a setting where the people in charge have insulated themselves from legal problems, so that you don't create a problem. You're depressed and then you do ayahuasca and then you have some legal issues. But you know I've met a lot of patients and some of my colleagues and friends who've experimented with mushrooms and ayahuasca and San Pedro, and the general consensus has been that it's been very helpful. So I don't think they're going to go wrong. They just need to pick experienced people that are going to not fly by night clinics.
Yeah, that makes sense. What would you say to people who are scared of having a bad trip with ketamine? And how should one actually prepare for a ketamine experience?
So a quote unquote bad trip seldom happens, especially in the initial stages, as long as the clinic doesn't dose the patient too high right out of the bat, or initially. Um, the way to address that is to be properly educated on the front end. In other words, I tell all our patients, you may be in the 5% or 10% who quote unquote have a bad trip, but let's define a bad trip. A bad trip with ketamine is you're scared or you're sad and tearful for a brief period of time, maybe 5 minutes. We're going to be there to reassure you and remind you that you're doing ketamine and that you're going to be back to yourself and much better once you get through the treatment. And usually what patients describe in a bad trip is they relive a past trauma, which isn't necessarily a bad thing because you're purging something negative through ketamine. And generally, and sometimes people will relive a past trauma that they weren't aware of, and sometimes they are aware of it. But the example that I like to give is, let's say, this part of the story is true. I was an altar boy in my past, but I was never molested by a priest. I was solicited, but nothing ever bad happened. But let's pretend it did happen. And so every time I hear the word priest or rape or molest, I get really triggered and anxious and then extremely depressed. Well, during ketamine, you might relive that horrible encounter with that rapist, and it's very unpleasant. But after ketamine, with your brain recovered and reset through ketamine, your brain has the ability to put the brakes on going into that rabbit hole of anxiety and depression. And your brain does it almost automatically. So, right now, if we said, okay, I could tell you I'm no longer worried about priests because I know martial arts. I don't go to Catholic church. The priests that are my friends are ex-priests. And, if I confronted three priests, I could annihilate them with my skills. So I'm no longer worried about that, right? But I had to say that to you talking over a minute or so. After ketamine, you have that discussion with yourself in milliseconds, and you remind yourself, oh my gosh, that was then when I was 10. I'm no longer in that space. I know how to protect myself, and that's not going to happen to me. And that's the beauty of ketamine. You internally have that discussion with yourself in milliseconds, and you don't go into that negative space. And so what's important to do before ketamine is talk to yourself and prepave a good experience. And what that entails is you're going to say, okay, if by some, bad stroke, I have a bad trip, I'm going to remind myself, because you're not so sedated, that this is going to be short lived. And that when I get to the other side of this experience, I'm going to be far, far better off. Because even if you have a bad experience, which is rare again, your brain is dramatically enhanced through the ketamine therapy, and you're going to be a far better off person once you get your treatment. And you are not so deeply sedated that you can't say, okay, do a little bit of self-talk and say, okay, I'm having a bad experience, but ketamine is still helping me. And if you're too sedated, we're going to be there to turn off your IV and reorient you and calm you down. And so bad trips have really never been a big issue because we we educate the patient on how to deal with it, and it doesn't happen until you get to higher doses in most cases. And since they're equipped and we're there to support them, it's essentially a non-issue. And so I think the bad trip fear is magnified unnecessarily, because most people will never have the bad trip, and the few that do, it's very short-lived. And again, you want to think of it as a therapeutic purging. Okay, I relived this horrible trauma, and now I'm getting rid of it, and it's no longer going to have a hold on me.
Mhm. That's amazing. I really appreciate you being so descriptive about that experience for those that are oftentimes so scared about coming into their first ketamine experience. I was curious if you can provide an overview of your services, your unique approaches, protocols, and also describe for those that are coming to you for treatment for the first time. What does that look like?
So we see patients through telemedicine. So you can do a Zoom video conference with us, or you can do it in person if you prefer. Of course, to receive ketamine therapy, it has to happen in person. We have you fill out a very detailed questionnaire to get a feel for the magnitude of your challenges. Is it just depression? Is there anxiety or PTSD or OCD components? We also ask questions to help us uh, learn if you have other factors that could be contributing to your depression. We tend to think of depression as, you know, a mental health challenge that happened to us for psychological reasons, and a lot of that is true, and that's the sequence. But depression can be caused by toxins in our environment, heavy metals. It can be caused by recurrent viral infections that can, you know, affect your thyroid. So besides having a detailed questionnaire, we always do some blood work on you to make sure that we're not missing something basic like thyroid dysfunction or anemia, or, you know, kidney dysfunction or electrolyte dysfunction. We like to know what your vitamin D level is. Vitamin D is a very therapeutic vitamin that can help. It's really a hormone, by the way, and it can help you become much, much more resistant to future depression and infections and heart disease and cancer. So we like to do a face-to-face or telemedicine consult, and then we'll have you do the intake forms, and then we'll order blood work for you. And then as soon as I review it, we get back to you by email, and then you can schedule. And typically, people will schedule 3 sessions for 2 weeks in a row. So three one week, three the next, or 2 sessions per week for 3 weeks. And um, we will teach you how to do some breath work, how to use healing frequencies. We give you a reading list of books that have been very helpful to me in the past that are very manageable. And there's also, you know, audio books that you can listen to on YouTube for free. So we make learning new skills easy and entertaining. There's also certain supplements that can be very helpful. I'm sure a lot of your members know about L-theanine, and that's very helpful to depression, or lavender. We like our patients to learn how to take magnesium Epsom salt baths with lavender. Lavender is a mood elevator, helps with anxiety, and it's really good to go to bed with very relaxed muscles, so your muscles aren't squeezing your nerves and causing you pain. And magnesium is very good for your brain and your heart. So there's lots of little skills that are easy to incorporate into your daily life to enhance your ketamine sessions, and to enhance your life after ketamine. And, you know, a lot of clinics will encourage people to sign up for a package with monthly ketamine, and there's nothing wrong with that. But we try to have you do boosters of ketamine when you feel you need them. And we use the form PH9, which many of you are familiar with. And on our website, you can go on anytime. And what our patients do is they fill out that form at the beginning, but after they've done ketamine once a week, they'll do that form, and it self scores, and it gives them a number of where they are in their level of depression. And we tell them that if your score is climbing 2 weeks in a row, and the skills that you've learned, you know, sometimes we learn them and we stop doing them. Well, you double up on your skill sets and start, you know, walking, connecting with people who you know are supportive, and all the things that you learn. And if you still see that your PH9 score is climbing, then you're going to need a booster. We seldom find patients who need monthly boosters. And, you know, our goal is to empower the patient to not need us as much as possible. And we, you know, definitely never try to replace their psychiatrist or psychologist. We want to work in harmony with those people. But, you know, the more skills and healthy habits that the patient can develop, the more resilient they are and the less they need ketamine.
That's right. How do you create a safe and supportive environment for patients coming in for treatment?
So we have private rooms, lazy boy chairs with heat and massage, and we have some comfort stuffed animals. We encourage healing music, and we like you to have a babysitter. If not, one of my staff will babysit you, quote unquote. And we're there just as psychological support. When patients experience ketamine therapy, we don't try to engage them in talk therapy. That we believe should happen after the session, right after or the next day. Um, but it's comforting to have a familiar voice should you get agitated. And the way we handle that is we'll stop the drip and reassure the person that they're in a safe place, and that they just got a little bit agitated. But as I said, it doesn't happen very often. And often when it does happen, if you have your friend or your spouse with you and they say, hey, it's okay, you're at the doctor's office, that familiar voice that you recognize is often enough to keep you, from escalating. So, but the environment, in our opinion, needs to be private and quiet. And we also, little things that, but we like the person to use the bathroom before they get their infusion, because afterwards they're going to be a little bit groggy and have poor balance. And we don't want to have them immediately need to use the restroom right after they finish their ketamine experience.
That's helpful. And I was curious, what kind of qualifications or certifications do you have as it relates to psychedelic therapy or ketamine treatments?
So as I mentioned, I use ketamine in the emergency department to sew up little kids. I used it in my anesthesia residency. So I got many opportunities to use ketamine for non mental health issues. And um, but by the time I put together a protocol for mental health and chronic pain, I was already very comfortable with ketamine. And thankfully, ketamine, if used judiciously, is a very safe medicine. If not used judiciously, it has killed people. And if overused, it can be an addictive medication, like so many others, Valium and Xanax. But my residency training is what I based my comfort and experience on. And now an additional 8 years of using ketamine for complex regional pain syndrome to treatment resistant depression and PTSD. And to your point, I do think folks think of ketamine as a very safe medication because people abused it on in the 80s and 90s. It was called Special K, and it's also been labeled as a horse tranquilizer. But it's used as a sedative for surgery in both humans and animals. And when used appropriately, it is very safe. But if you give too much too fast, it can take away your respiratory drive. And in the last 2 years, there were 5 accidental deaths by paramedics who were got special training in the use of ketamine. So where I'm going with that is that folks who aren't very experienced with ketamine should get trained by people who are qualified and skilled, so that you know how to administer ketamine and you don't increase the dose too quickly or give too much, because that's when people can get into trouble.
Yeah, that's helpful. You referenced how ketamine used to be used on the battlefield. I was curious if you have any experience working with specific populations like the veteran community.
Well, I'm glad you mentioned that. We were recently approved by the VA to help veterans with treatment-resistant depression and PTSD. And we're very excited about that. Our IB manager, both of her adult sons that are in their 40s, are veterans. One was a special forces trained gentleman, and the other one was in the Navy. And so when I mentioned to her, I've wanted, I feel very indebted to all of our servicemen and women and their families. They all make a huge sacrifice, just like, firemen and police officers, but even bigger. And so I've tried to connect with the VA for many, many years unsuccessfully. And just recently, through different situations, it all fell into place. And instead of me chasing different VA representatives, the VA called us, and I'm really excited. And she is really excited because she's always, our whole office feels very sentimental and thankful for the men and women that protect this country. And so finally, now we're going to be able to treat veterans, and they're not going to have to pay anything.
Wow.
And it's a wonderful opportunity for everybody involved, and we're very, very excited about it.
That's remarkable. Very, very just in awe that the veteran community is going to be able to be served in that way. I was curious, how do you help your patients reach their goals?
So good question. I I always stress that the first thing is to believe that things can get better, right? So some folks come with, moderate depression and they have goals, but others are like I felt, 30 years ago, they're in a dark hole, and they just want to not feel depressed. They don't have any goals. But once they start not feeling depressed, then they start to, say, well, I'd really like to get a job, or I'd really like to, start connecting with my family. And so, it boils down to something that's simple to say but harder to do, but not that hard once you start incorporating it into your daily life. And that is, and I've learned a lot from patients and other clinicians, but there's a neurobiologist from Scripps Institute in California, and his name escapes me, but he's an atheist. And he said, even though I'm an atheist, every morning I wake up and go through my gratitude list for a minute or two. And I often say the same things. I'm thankful for the roof over my house, my car, the work that I do, my family. But going through that effort, which is not that big, but it is big when you're not used to it, he goes, has changed my life dramatically, because I start my day by giving thanks, and it allows for other more positive things to happen. And sure, I have, bumpy days and challenging situations, but they're less frequent and less intense since I've adopted, my minute or two of morning gratitude. And then we teach patients how to do breath work to learn to calm themselves down. And once you learn it, and it's very easy to learn, you realize that through breath work, you can't focus on your worry list or your to-do list while you're simultaneously focusing on breath work, which we like folks to learn how to do at night. And we have them do 5 to 10 breaths every night that they can remember. And the most important thing we teach them is don't get mad at yourself and don't criticize yourself if you forget, because there's another night that when you'll remember to do it. But breath work, certain books that we like them to read. And again, if you've ever been depressed, it's very hard to concentrate and read. But thankfully, with our phones, there's a lot of free audio books, and there's a lot of ways to instill good thoughts into your brain, and habits and ideas that can move you forward. So we teach breath work, we have reading lists, and we teach self-talk and the value of, not being so vicious with yourself. And a lot of folks with depression and OCD and PTSD have a tendency to be perfectionistic. and be extremely critical of themselves to the point of being unreasonable. And so we try to undo that and unpackage that by teaching them, okay, in all the times that you've attacked yourself, what was the benefit? Did you really feel that it was worthwhile? And why not try, X, Y, Z? And we've had many patients come back. I had a patient with pronounced addiction issues. He was a 40-year-old carpenter. He hurt his back, got addicted to Vicodin, and his family doctor wouldn't give him Vicodin after 3 months. So he ended up stuck at a methadone clinic where you lose, 3 or 4 hours of your life every day to get your methadone fix. And it's next to impossible to hold work. So he came to us to be placed on Suboxone, and we, put people on Suboxone and then wean them off and switch them to naltrexone. So I inherited him from the methadone clinic, and he was seeing a psychiatrist who had him on gabapentin for pain, an antipsychotic, an antidepressant, Valium and Xanax, and he also was taking methadone. So, he was clearly over medicated and he couldn't work because of the methadone clinic, but also it wouldn't be safe for him to work with all those medicines. And I told him, the only way for me to prescribe Suboxone is if you stop taking Valium and Xanax, because it's too easy for you to accidentally overdose. And he said, well, doc, how am I going to do that? I've had severe depression, anxiety, and insomnia since age 10. I was molested by my stepfather. I mean, I have quote unquote real problems. Mm-hmm. And he's married, as I said, with 2 kids. And I said, well, if you learn how to breathe the way I'm going to teach you, I promise you, you won't need the Valium and the Xanax. So this gentleman, in a year and a half, through breath work, and he never did ketamine, by the way. He was a person challenged with addiction. But through breath work in a year and a half, he took himself off of all of those medications. Wow. And he went from 16 milligrams of Suboxone per day down to 2. And that by itself is fiercely impressive. But in that same year and a half, he got a job at the beginning of that year and a half remodeling McDonald's and Wendy's outside of Louisville. And he started in a crew of 10. He was a carpenter. At the end of that year and a half, he was supervising 4 crews of 10, and he had become the right-hand man to the owner of the company, and he was bidding jobs and making sure they came in under the bid. Mind-blowing, right? And again, this is a guy who's been crippled with anxiety since age 10. And he said, as he was getting promoted, I kept saying, how are you doing that? And he goes, oh, I just do that breathing thing that you taught me. I'll go into the McDonald's bathroom, take 2 or 4 breaths, go back into the construction yard and start telling people what to do. And by the way, he was 5'4" and 125 pounds wet. So not a big construction guy. And in a construction zone, you're often dealing with big men and women, often with, addiction and alcohol issues. So he grew in confidence dramatically. And he said, hey, can I have an extra week of Suboxone? Because we give them a month's worth. I want to take my family on vacation to Florida. And I said, sure. And he comes back a month later and he goes, doc, I have something to tell you. And I go, uh-oh, what happened in Florida? Did you buy? Did you use? He goes, no, I'm way past that. And I go, okay, well, what happened? Okay. And he goes, I ran into a friend of mine who wanted my help. So I let my family vacation and I went to work with him. And I discovered that in Florida, I can make twice as much money working for myself. So the good news and the bad news is the same. I'm moving to Florida and I'm going to start my own little remodeling company. And I just want you to know that you've been helpful, but what truly has changed my life is breathing, breath work. I do it all the time. I do it at night to help myself go to sleep, and I do it during the day when I'm confronting stressful situations. And he goes, I think, and he was right, by the way, you only teach breath work to your patients with addiction and your patients with anxiety and depression, and you need to teach all your patients. So that's what we do now. We teach, our cancer patients and heart patients breath work. And it's truly probably the most important thing that I teach patients, because they can bring themselves to center within 2 to 4 breaths and not feel out of control. And the gist of it is, when you take a big breath and hold your breath and then exhale really slowly, the way people smoke marijuana, they're actually inadvertently raising the carbon dioxide level in their blood. And when you raise the carbon dioxide level in your blood, you stimulate your parasympathetic nervous system, which in turn slows down your heart rate, your breathing, and brings you down back to center. And, by breathing that way, you are mimicking what we did in the old days in the emergency department. When somebody had a panic attack, we put a bag over their nose and mouth and made them breathe their own carbon dioxide. And we all know conceptually, oh, that breaks a panic attack. But what does it is that the carbon dioxide in their blood raises, stimulating their parasympathetic nervous system, which then slows down their heart rate and their breathing and calms them down so they can start thinking again. So, that's one of the easiest, most fundamental skills that we teach. And for those who adopt it, it's profoundly powerful. And I use breath work on myself routinely. So I think, lots of little skills like that add up to a profound beneficial effect.
I'm just really appreciating how you're bringing the science into this too. And it just really helps solidify why these various modalities are so potent and so powerful. I know that you are a founding member of the American Academy of Ozone Therapists. So I was curious if you can elaborate about the integrative approaches and the practice that you offer outside of just ketamine.
Well, thank you for asking that. As I mentioned, I did emergency medicine for 10 years and 2 years of anesthesia, and then I shifted into integrative medicine. So I trained with the American Academy of Ozone Therapists. I was one of their founding members. The founder of that academy is Dr. Frank Schallenberger, who's well known in integrative medicine circles. He brought ozone therapy from Germany, where it's been around. We're going to be a little bit late, Karen. It's been around for, at least 75 years. And ozone therapy is very useful for boosting immunity. It can be injected in an IV mixed with saline and or a patient's blood. It can be given intramuscularly or into a joint for folks who have arthritis or tendonitis. And it's a wonderful modality. And then I've just done a lot of extra training besides those 2 residencies. So I trained on prolotherapy and prolozone, and stem cell therapy. We harvest stem cells from belly fat and bone marrow. We can have your stem cells cultured at a lab in Florida, which is legal. And as I was saying earlier, depression can be caused not just by quote unquote stinking thinking, but your thyroid may be off, or maybe you're a farmer or a painter or a dentist and you have been exposed to a lot of heavy metal burdens like lead and mercury. And so, maybe your testosterone is in the toilet, and that can create severe anxiety and depression. So we look for other contributing factors, not just, I'm psychologically depressed. And, all the training I've done, hormone replacement, has helped me consider other things that could be a factor in the person's struggle with depression, anxiety, etc.
That's great. And I was curious, is there anything else that I haven't asked you that you'd like to share with our viewers?
Let's see. We're very well versed in the use of ketamine. We offer some very unique therapies in terms of reversing heart disease. We're successful in reversing stroke and traumatic brain injury symptoms even 20 years after the event. I treated my father for stroke, and Karen, the practice manager's father, he came to us 20 years after his stroke and responded beautifully. Um, and it's an exciting area because not many people are treating neurological issues the way we do. And and the stem cell area is also a lot of fun because every week we get patients who say, you know, my orthopedic surgeon says I have to have my knee replaced, and you know, with PRP or stem cells, we can postpone that surgery for several years in the majority of cases. So we have a very diverse practice, which makes it very entertaining and rewarding because we have a lot of happy patients.
That's incredible, Dr. Cruz. Well, thank you so much for your time today. You have been a wealth of wisdom, experience, and information for us. Thank you for the incredible work that you're doing and just paving the way in the space for all of us to continue to dive further deeper into the psychedelic space. So thank you again for everything that you do.
Thank you, Jamie. I think you're doing even more work by bringing us together and making more of the public aware that this is a very viable and safe therapy. So thank you for all the hard work you're doing.
My pleasure. It's my honor. Thank you so much.